Do you have to hear this sound every night? Snoring is one of those sounds that nobody wants to hear from their bed partner. Sometimes these harsh, raspy sounds can be more than just annoying. It can be a sign of a serious disease and can be life-threatening too. Half of 90 million Americans who snore have obstructive sleep apnea. Now, obstructive sleep apnea or OSA is linked to heart disease and can even be fatal when left untreated. What's even more astonishing is that you can have OSA and not even know about it at all. Many people avoid seeking help for snoring because they don't think it's a big deal, or they don't want to undergo an overnight sleep test in a lab, or they're worried they may be diagnosed with OSA and have to use CPAP, the continuous positive airway pressure machine. So today, we're going to be talking about what is sleep apnea, the different types of sleep apnea, signs and symptoms of sleep apnea, the causes, as well as the risk factors. Welcome everyone, this is Dr. Jasprit Singh.
Sleep apnea is a potentially serious sleep disorder in which your breathing repeatedly stops and starts. Obstructive sleep apnea is the most common sleep-related breathing disorder.
So sleep apnea can be divided into two different categories, the obstructive sleep apnea or OSA or central sleep apnea, CSA. OSA is the most common and happens when the throat muscles relax and block the passageway of air into the lungs. CSA happens when the brain doesn't send appropriate signals to the muscles that control our breathing. Signs and symptoms of sleep apnea: loud snoring, episodes where you stop breathing while you're asleep, usually noticed by somebody who's around you, gasping for air during sleep, morning headache, waking up with a dry mouth, having a hard time staying asleep, also called insomnia, increased sleepiness during the day, decreased attention span while awake, and irritability. Next, let's jump into the causes of sleep apnea. For OSA, like I previously mentioned, it happens when the muscles in the back of your throat relax and occlude the airway that leads air into the lungs. These muscles usually support a soft palate, the uvula, the triangular piece of tissue hanging from the soft palate, tonsils, side walls of the throat, and tongue. When these muscles relax, the airway narrows or closes when you breathe. You're not able to get enough air, which can lower the oxygen levels in your blood. Your brain realizes that you cannot breathe and briefly wakes you up to reopen your airway. This episode of waking up can be so brief that you may not even remember it. You might also snort, choke, or gasp. This pattern can repeat itself 5 to 30 or even more times per hour throughout the night. This pattern makes it hard to reach restful deep sleep, which can lead to the daytime sleepiness, restlessness, and irritability. Moving on to CSA. Now, CSA is less common than OSA and happens when the brain fails to send the proper signals to the muscles that control your breathing. This leads to no effort from those muscles for a short period of time. You will wake up feeling short of breath or may start having a difficult time falling asleep or staying asleep. And if you're enjoying the content of this video and want to see more videos like this, please like this video and consider subscribing to the channel. Now moving on to our last topic of this video, the risk factors of sleep apnea. For OSA, the risk factors are obesity. Obesity is a major risk factor for OSA as a fat deposit in your upper airway can lead to narrowing of the airway. Narrow airway, you may inherently have a narrow airway or may have a tonsil or adenoid enlargement, especially in children that can narrow the airway as well. Being male, men are 2 to 3 times more likely to have sleep apnea than women. The risk for women increases if they're overweight or if they go through menopause. Age, sleep apnea happens more commonly in older adults. Use of alcohol or sedatives. Use of these substances can relax the muscles in the back of your throat and lead to worsening OSA. Smoking. People who smoke are 3 times more likely to have OSA than people who don't smoke. Smoking can lead to inflammation and fluid retention in the upper airway. Nasal congestion. If you're having trouble breathing through your nose, whether it be through anatomical issues or from allergies, that also increases your risk of OSA as well. Other medical conditions like congestive heart failure, high blood pressure, and diabetes can also increase your risk as well. Polycystic ovarian syndrome, hormonal disorders, prior stroke, or chronic lung disease like asthma can also increase your risk of having OSA. Risk factors for CSA include age. People who are middle age or older are more likely to have CSA. Being male. Yes, CSA is also more common in male than female. I think when it comes to sleep apnea, men just drew the short straw. Heart diseases like congestive heart failure also increase your risk as well. Using narcotic pain medications, especially long-acting pain medication, can also increase your risk of CSA. Alright, so in this video, I've covered what is sleep apnea, different types of sleep apnea, signs and symptoms of it, causes of it, as well as its risk factors. Comment below if you guys found this information useful, and comment if you guys want me to cover any particular topic for a video in the future as well. I'll be making a follow-up video on the complications of sleep apnea, how it's diagnosed, and the treatment options for it as well. So stay tuned for part 2 of Snores in the Night. As always, guys, thank you so much for watching. I really appreciate it, and I'm going to see you next time.